Okay, we'll record. So we're week 7, exam 2 is done. That's done, check. We have discussion question number 5 due, so that's due by Wednesday. You have a case study, ALL, acute lymphocytic leukemia, and you have a dosage calculate with confidence, the pediatric portion of that. So that is what is due by Sunday. So this week, is a rough week. We're going on, cerebral dysfunction and endocrine. They're both pretty intense. I'm going to try to bring it down and make it simpler for you, okay? So let's just go ahead and get started, and we can be out probably right at 8 o'clock. Growth hormone is administered by what route? Now, this is one of the reasons why we measure our children, the height and the weight every time they're visited, go to urgent care, emergency room. And we can give growth hormone for those children who are very small. And we can make them, instead of being 4'2", we can get them up to, 4'8", 4'9", which is a better growth. And we give this by subcutaneous injection, could be daily, every other day, weekly, depending on physicians, what they want you to do. But we give it until they stop growing is basically what they say about it. You give it until they're no more growing. It's usually about adolescence. So highest priority for a patient diagnosed with syndrome of inappropriate antidiuretic hormone. Well, antidiuretic means antidiuresis, which means you are not urinating. Okay, syndrome means that you're really not urinating. There are many factors that are stopping you. So we know when we talk about anything with diuresis, whether they are or not, intake output number 1. Also, weights, daily weights are always important. Which of the following are signs of syndrome of inappropriate antidiuretic hormone? What would you see with a child who has inappropriate antidiuretic? Very clearly again, against diuresis, what would you see? You're not going to see any urine, right? Antidiuresis, against urine output, decreased, okay? Just think about the words, what they're saying. Polypropofol and metazole are used to treat. These are 2 medications that are given for thyroid disease. We know thyroid disease is either hypothyroidism or hyperthyroidism. The common for hypothyroidism is your synthroid or levothyroxine. The common ones for hyperthyroidism, it's PTU is the other name, and methimazole. And that's what we use unless we need to ablate or get rid of that thyroid. Thyroid is very important, and we need it for growth. We need it for cognition as young children. One of the things that we need to teach our patients on these hyperthyroid medicines, especially PTU, that it can cause neutropenia. So if the child becomes sick, getting fevers, they need to talk to their physician about it because the medicine can do it. So what's important to cover when teaching that family about PTU? The propylothyroxine. And again, that's the leukopenia that it can cause. It's one of those teaching things that we need to describe to our families and to our children so they know. And Wendy's on fire. An initial sign of diabetes insipidus is, now remember, diabetes insipidus has nothing, not a thing to do with blood sugars. I can't tell you how many RNs would take blood sugars for a child with a history of diabetes insipidus, and I'd ask, but why? And they didn't understand. So what is diabetes insipidus is you drink a lot and you also urinate a lot. And the more you drink, the more you urinate. Now in infants, you can give them a bottle, breastfeed, and they'll cry for more, for more, for more. Give an infant a bottle of water and they will be satisfied. So that's a crazy thing about diabetes insipidus. And one of the things that we'll do to an infant just to try to get the diagnosis, what's going on. Multi-select. What are the clinical manifestations of juvenile hypothyroidism? Now, hypothyroidism, adult or children, very similar, almost the same. The only thing with children is that we know that these children do grow, right? And we also know hypothyroidism at birth can decrease cognition, and your child, will not be up and meeting all those developmental levels. So it's the dry skin, constipation. It has nothing to do with weight loss, although they say hypothyroidism, you gain weight, and hyperthyroidism, you lose weight, but minimally. But it's the dry skin, constipation, growth, and cold intolerance, those things, just like adults. Claudia's now on fire. So a child has a simple febrile seizure. What education would you provide the parents? Now, we talked a little bit about febrile seizures, and we talked about, having the fever and if it was dangerous. Remember, once you have a fever, you're actually safe. It is that rate of rise that goes so quick that causes the seizures. So if we have a child who has febrile seizures, we want to teach that parent what to do when it happens. I mean, you cannot always catch the Tylenol and Motrin before they have a fever. It's just an impossibility. So teach them how to be safe. Turn the child to the side. If they're in the hospital, pad the side rails. As a nurse, you'll be looking at how long did it last? What did it look like? What type of seizure is when the body is jerking, foaming at the mouth, and the child is rendered unconscious? This is the one that we think of when we have seizures. It's not those blank look things that we can have. It's more of that tonic-clonic, used to be the grand mal, they called it, but it's the whole body. Again, nursing responsibility. We want to protect airway, turn them to the side, protect them with having the side rails there. Lower the bed so that, we can keep them to the side and have suction ready, just in case they vomit, because many times they will. After a fall, what assessment would be considered a neurological emergency? Kid fell off the second floor of the house. He slipped on the roof, fell on his head. What would be considered really, really bad? What is a neurological emergency? We know when you think of neuroscience, you think of pupils. If you have a fixed dilated pupil, it's what we in the medical field call a blown pupil, which means it's dilated. That's scary. That means there's so much pressure going on there. We need to remove it now, or it's going to be a permanent deficit on these children. So that pupil, that fixed pupil, is really bad. With a patient with a head injury, the signs of increased intracranial pressure include, do you have a child who fell and they look fine? You're checking neurosigns, their grips, etc. They look all right. Then what happens? Because that's going to show you the increased pressure. And that's when they go from being awake and alert to asking you. Many of these children with head injuries have been in a baseball game or some sort of sport, and they've really hit their head. They're going to ask you, did we win the game? Or if they're playing baseball, did I make it? Was I safe? They're going to ask that, but over and over and over again. It's like an amnesia. What notable sign may indicate increased intracranial pressure in an infant? Now, this sign, when you walk into a room of infants and one is in there that has a increased intracranial pressure or really neuro, you are going to hear. It's like nails on a chalkboard. It is a very, very high-pitched cry, and they're very hard to console too. They're, they've got so much pressure, it hurts. They'll show that. They also show you with the scalp veins starting to bulge in their head also. And of course, the fontanelle, if they're young enough, we can see that starting to bulge, and that's showing pressure. There's fluid, something's happening in that brain. All of the following increase cranial pressure except. So we're taking care of that child who has fallen, who has a brain injury of some sort, and most likely they're intubated and being watched closely. We're doing neuro checks, vital signs. Now, it doesn't matter their heart rate. Heart rate has nothing to do with pressure. It's that touch that we do, that gagging from coughing and suctioning, and then turning them side to side because it could hurt their head, with headaches because of this. So vital signs, the heart rate up does not affect it. Which of the following signs and symptoms are more common in children than adults following a head trauma? I mean, this little boy in the picture, those big nuts are not uncommon in children. So adults do not vomit like children do. Children get a headache and they'll vomit. They hit their head, not even as hard as, they could. They're going to be nauseous, they're going to vomit. So vomiting is more common in children than it is adults. What medication may be used for a child with cerebral edema due to a fall? Well, cerebral edema means fluid in the brain. What is the best thing specific to the head that we can use to decrease that swelling that's going on? And it is mannitol. Furosemide is, when you have congestive heart failure, pulmonary edema, you have swelling of the ankles, is great. But for the head, mannitol. That's the #1 thing that we will use to help decrease the swelling in their brains. Reyes syndrome, what's that? I mean, we mentioned Reyes syndrome when we talked about Kawasaki disease. And Reyes syndrome is taking aspirin as a young, child. It is a metabolic disorder that's inherent, and it's all about kids. The only time we give aspirin under controlled situation is that Kawasaki, because we need to, stop the clots and the inflammation. Febrile seizures usually occur in children what ages? And it's that 6 months to 6 years. Usually after 6 years, you could tell a parent the likelihood of a febrile seizures have really gone down to nothing. I know my daughter-in-law has the firstborn had a febrile seizure. She carries a thermometer everywhere and she still takes her temperatures, and they're 7 and 9 years old now. Childhood hypopituitarism results in which condition? And the pituitary gland has 2 lobes. We have anterior and posterior lobes. An undersecretion of pituitary gland, it deals with growth and how tall you are. So you don't have enough, you're going to be tall. You're going to be not tall. You're going to be, very short. As in hyperpituitarism, very tall, gigantism it's called. How would you describe precocious puberty? Well, we know puberty usually occurs at a certain roundabout age. but it's when you reach puberty early, and it could be, a 6-year-old young girl getting puberty. Even boys get like beards very, very young. They go through puberty, and we can waylay that by injections, Lupron injections actually, and it could stop them. Can you imagine a young girl at 6 years old getting breasts? That could be very uncomfortable for that girl, and the teasing that would go on. So we can stop it till about 10, 12 years old when it should be. Congenital hypothyroidism. You're born with it. Congenital always means they're from birth. We know that if we have hypothyroidism, if we don't know the mother is even involved and has thyroid problems, one of the things that will make us check for the thyroid function is constipation. Remember I talked about cystic fibrosis last week? Is another one. No stool, we're going to be checking for thyroid problems and CF. Now, congenital hypothyroidism could be caused due to mom, and she doesn't have enough iron in her, and females also are more. Now, thyroid gland hormones are so important, and it really helps, cognitive delays will occur if you don't have enough of that thyroid hormone in your body. What acid-base alteration would you see in a diabetic child with Kussmaul's respiration? Well, when you're to the point of Kussmaul's, you're in a diabetic ketoacidosis state, which means your body, metabolic acidosis. So your body's trying to go against it, right? So your body is going to go into respiratory alkalosis to try to correct it, right? That's why there's Kussmaul's respirations. It's saying slow and prolonged respirations. It causes an alkalotic state, which tries to correct what diabetes has done with the metabolic acidosis, okay? What is hypothyroidism? What does that mean? All it means is there's just very low activity. You're not getting enough hormone into the body. And hypothyroidism does need the replacement. Remember, synthroid, levothyroxine, you can't interchange them without a physician order. There's some little bit of something different, even though they should be the same. A multi-select. What would a child with Cushing syndrome look like? Now, this is your adrenal gland. Your adrenal gland does what? Your adrenal gland produces cortisol and aldosterone. Now, cortisol, what does that do? Well, Cushing syndrome is too much steroids, and it's usually not what our body has, but what we take in. Many syndromes, rheumatoid arthritis, lupus, they take prednisone in order to manage the symptoms. And if they're given too much, they're going to go into Cushing syndrome. And these children, just like the adults, big round cheeks, hair in places that a child shouldn't have, big round pendulous body, and they are going to be skinny. No, absolutely not. They're going to be big and hefty. And they can correct it once they decrease the steroids. And again, steroids should always, always be tapered, or you go into an adrenal crisis. Seizures in children most often are the result of what? And that is the abrupt rise in body temperature. Most common seizures are febrile seizures. Again, 6 months to about 6 years old, they grow out of them. As nurses, we're going to protect them. We're going to turn them to the side. We're going to pad the side rails. We're going to make sure their airway is open and have suction available.
Ms. Bogart, I got a question really quick.
Hold on.
Okay.
Autoimmune of the thyroid gland is called what? And I'll answer you, no problem. Sorry, I pushed too quick. And that's called Hashimoto's. It's usually females, late school age to adolescence. And this is where they need to replace hormones into their body, thyroid hormones. This is not a surgical choice at all. No surgery can be done. What was the question?
I'm sorry. So my question is, we were talking about the like the patient who has lupus, for example, right? So say they're taking the medicine for the lupus, but then it gives them Cushing syndrome, but
I
they need
had it
it
with
for.
RA. I had it with RA.
So what do? You just take the side effects?
Well, you have to take it to order to manage it, but as soon as possible, start decreasing the doses. I am now completely off steroids, but I blew up 80 pounds. I was total Cushing's. That was a great question. So yes, my weight has come down now because now I've tapered it off very slowly. Okay. If you have to take it, you have to. Because in lupus or RA, you have a lot of pain if you don't. It really helps with the pain. Addison's disease is opposite of Cushing's, another adrenal issue. Remember, if there's a too much, there's always a too little in anything. Okay, so think about both when you think of one. It is that decreased secretion of cortisol and aldosterone. The body own is not doing what they need to do. So how do we treat it? We give steroids, right? And steroids can be given for stress, for illness, for other stuff. When the body goes through that, it just given a little bit during that time, and that helps with it. A multi-select. Ventricular peritoneal shunt. Ventricular is the fourth ventricle in the brain, that little butterfly area. And that's a tube or a shunt that goes right in there. It comes behind the ear. There's a little pump thing here, comes in front of the body and goes down into the peritoneum. And what it does, it takes that cerebral spinal fluid that's building up, causing all of this hydrocephalus, causing big, fontanelles. You can see the head getting big, child's getting headaches, probably vomiting too. So you put it in and it decreases. Nursing function, measure that head every shift, measure that abdomen, abdominal circumferences every shift. And that shunt, you leave it alone. It is only for the neurosurgeon to touch. All we can do is the measuring. And of course, intake and output, daily weights, very important. A common sign of Graves' disease includes blank or protrusion of the eyes. Hyperthyroidism, another name, Graves'. And that's called exophthalmos. Good. Have you seen that commercial on that where they have all of the sunglasses and you can't see and it's new eye drops they're putting in? I laugh at it. A multi-select. What are signs of hyperparathyroidism? Well, you have to know, what does the parathyroid do? Parathyroid monitors and regulates the calcium in the body. What does calcium do? Calcium, magnesium are about the same. And when you think of those things, think of muscle contraction, like calcium channel blockers. I mean, this has to do with muscles and the movement. So what are the signs of hyper? Too much. You're going to see too much calcium, which makes you nauseous, vomit, you get confused, and then you're going to get the numbness in the extremities because you have too much. You are not going to be able to move as well because too much calcium is going on in your body. So parathyroid, calcium. A multi-select. Hypoparathyroidism has the symptoms of tetanic muscle contractions and what? Hypo, remember that's low. What does parathyroid do? When you don't have calcium in your body, how do you feel? Again, it's all about muscles, right? Muscle weakness, tetany, and it's going to have those low calcium levels. My brother just had that surgically removed. What does the parathyroid hormone do? After all that, you know the answer. Has to do with the calcium. Good job. Which of the following might be a cause of an adrenal crisis, Addisonian crisis? Addison's disease, Cushing's disease, adrenal crisis. And it has to do with those steroids that you just stop them and you don't taper them. I'm telling you, it took me 4 months to come off of 20 milligrams of prednisone, very, very slowly. A multi-select. Congenital hypoplasia parent teaching should include. Now, there's something that happens with infants, and it has to do with gender assigning hormones in the body. Sometimes the body doesn't have enough of the hormones needed. And what happens is a child can be born with, let's say, an enlarged clitoris and it has testicular sac, or it could have a penis and a vagina. So now what do? Well, this child will never have babies. They're infertile forever because they don't have the complete set of anything. So we need to see, is it a boy or a girl? Sometimes it's a parental choice. Sometimes it's when they go and they look at the hormones, what do they have more prevalent? And then they'll say, okay, let's make it a girl or boy. And these children will need cortisol and aldosterone replacements for life. What causes type 1 diabetes? Type 1 diabetes, what happens? You eat too much candy? So in the pancreas, there are these beta cells which secrete insulin, and the body itself tends to destroy these cells. So it's immunosuppressive type disease. So what happens if we don't have insulin? We have the sugar that you've eaten, but the body can't convert it to something it can use. So now you have sugar floating around everywhere. So the body says, you know, I'm hungry. Okay, I can't have sugar, but what else can I eat? So then it goes to the proteins. And then they start digesting proteins, and byproducts are what? Ketones. That's why you're going to see ketones in the urine in DKA, diabetic ketoacidosis, and you see elevated blood sugars like crazy. And then, of course, the acidosis. Which statement about a pheochromocytoma is correct? This is something with the adrenal gland. Very hard to diagnose. It produces severe tachycardia and elevated blood pressures and headaches in patients. And usually we have to stick them on those 24-hour Holter monitors to find these little tachydysrhythmias that's going on. But it's what we call a catecholamine producing tumor from the adrenal gland. And catecholamine means everything up, 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 sympathetic, right? Heart rate up, blood pressure up. And what we need to do is go in there and remove it once we determine. Now, before it's taken out, as a nurse, what is your nursing care? Well, if you know it's a catecholamine producing tumor, what symptoms would we see? Elevated heart rate, and you see an elevated blood pressure. So we need to monitor those vital signs very closely. So which action should the nurse implement in the care of a patient with a pheochromocytoma? And yes, we are going to monitor for high blood pressure or for elevated heart rate. A multi-select. Nursing care of the unconscious child include. It doesn't matter unconscious adult, child due to head injury. You're going to do a lot of the same things. It's basic nursing care. There's no difference. We're going to do neurosigns, Q2, vital signs, of course, with temperature, because temperatures do affect the pressures in the brain. And then, of course, strict INO. Now, pain control, most of these children are on some sort of sedation, but your most priority is the INO, neuros, and your vital signs. Symptoms of DKA are so fruity breath smells like a rotten peach. Ever have a rotten peach in a container, Tupperware container? You open it up, that smell that you get, that is exactly what you see with this, the acetone fruity breath. I walk into rooms that the doors are closed and I know exactly what's going on by the smell. Of course, there's blood sugars there because they can't digest it and because they are eating the proteins. The byproduct of protein digestion is ketones. So you see ketonuria. So it's all the above. Those are the basic concepts of DKA you need to know. DKA is caused by, and if you know this answer, you are good. So you have no insulin, you cannot digest sugar. The body says, I'm hungry. The other fuel, proteins and fats. We're going to start eating proteins, byproduct ketones. So diabetes is sugar. Diabetic ketoacidosis has the inclusion of ketones. A diabetic child complains of feeling jittery. The blood sugar's 45. What's the best treatment for the child? Now, if you read the question, the child's complaining of feeling jittery. So you're going to give them something to drink. They're alert enough to tell you. Orange juice, milk, they're both a great thing to try. Your patients experience a head injury. What would most concern you? So swelling in the brain can affect the pituitary gland. It has to do with that communication and urinary output. So decreasing urine output. And we know that if we see that, we're going to do vital signs and neurochecks. We want to see, are those pupils still okay? And if we're seeing that it's due to pressure, what are we going to do? We're going to give some mannitol. A multi-select. What would alert you that a child's head injury is deteriorating? I mean, some of these symptoms is what they start and their initial complaints are. But when you see things deteriorating, this is what you start to see. And that's that restlessness, that agitation, and then we're going to see that difficult to arouse or obtundation until it gets to that point. Nausea, headache, they have. That's a head injury. That's what children feel. Deteriorating are the other. A child's been diagnosed with bacterial meningitis. What is the nursing priority of care? What are you going to make sure that you're going to do for this child? What do they need the most to get better? And those are those antibiotics. Excellent, very good. Absolute priority. What is the primary cause of injury associated with submersion or drowning? We talked a little bit about drowning last week, but what is the injury that causes those acute respiratory distress syndromes up to 72 hours later? They went under. They were on the bottom of the pool. They came up, but it's that hypoxemia. Yes, excellent. Good job. A multi-select. Which CSF lab value correlates with bacterial meningitis diagnosis? So that picture of that cerebral spinal fluid is cloudy, sometimes even gets milky. When you see that, you're in trouble. It should be crystal clear. You shouldn't be able to see anything. I'd be waiting for that lab to see what it came back as, how many white blood cells, but what is the glucose? What is the protein? When you see elevated protein, decreased glucose, because bacteria love to eat all the sugar up, so it's low. When you see that with white blood cells, you know it's bacterial meningitis. I need to get that antibiotic in this child right now. Last question. Hyperfunction of pituitary gland in pre-adolescence results in what? Hyperfunction of the pituitary gland. And that's gigantism. Very good. Let's see how we did here, guys. Number 3. Jen. Good job, Jen. Number 2. Ari. Good job, Ari. Number 1. Claudia. Good job, guys. What I want you to do is sign your attendance. Mary and Wendy, 4 and 5. Sign your attendance attestations. Make sure you get them done so that you have it. Do I have any questions from anybody? If you want your exam results, just send me a message. I'm going to go eat right now, but I'll come back and look at it for you. I will see you all next week, and you'll have your grades either by Friday evening, 6, 7 o'clock. You'll have your final results. There's not going to be much manipulation on this exam. I did manipulate 2 math questions that were keyed wrong in the exam, but besides that, maybe 1 if we're lucky. Okay. So anyway, thank you guys. Great exam.
Thank you.
Good class. Thank you for coming back. Have a good night.